Hello, fellow survivors. My name is Michael Martin. I want to take a moment to speak to you about one of the scariest but necessary procedures placed in your immediate futures. I'm talking about open heart and vascular surgery. Now let's be honest. We'd love to be anywhere else right now. At home, work, or if you're young like me, working towards your goals and dreams to help make this world a better place. But I want to reassure you, at this very moment, you are in the right place. Here at Christ Advocate Medical Center and Hope's Children's Memorial Hospital, you are in gifted hands. How do I know so much about your circumstances? How do I know you are in gifted hands here at Christ? Because I am a fellow survivor, a living example and testimony of what those gifted hands can do. I have undergone 5 successful heart and vascular procedures in my 38 years of life. You see, I have a condition called Marfan Syndrome. Now, when I say Marfan Syndrome, a lot of people have never heard of it. Occasionally I'll hear, hey, isn't that the condition President Abraham Lincoln had? And I'll say, yes, it is. And they'll say, cool. But it's not cool. Marfan syndrome is a destructive genetic disease that seeks out to kill or maim every individual afflicted with it. Just ask the millions of men and women and children surviving with various circumstances caused by this debilitating disease today. From 2001 until this present day, I have had 90% of my aorta, the heart's main heart valve, replaced. But everything is okay. And life is all right. And do you know why? Because we are in gifted hands. Who are these individuals that own these gifted hands? Well, allow me to introduce you to my phenomenal doctors while I take you down the path of my surgical procedures. In May of 2001, at the tender age of 25, I had to have what is called an aortic root dissection repair. The root of my aortic valve, where the aorta connects to the heart, was replaced by a mechanical St. Jude valve. This surgery was extremely significant to me because it was the surgery that informed me that I had Marfan syndrome. But despite this life-altering diagnosis, everything was all right. And life was okay. And do you know why? Because I was in gifted hands. Those gifted hands belong to God and doctors Michael Perlman and George Hodakowski. In 2006, my genetic disease tried to kill me twice in the same year. In May of 2006, the upper arterial arch of my aorta began dissecting, causing me pain and disorientation. Within 30 minutes of being transported to Christ Advocate Medical Center, after having a procedure called a CTA of the chest, I was informed of what was causing my pain and disorientation. It was in ICU that I met the first set of gifted hands of a phenomenal surgical team. Those gifted hands belong to Dr. Pat Pappas. Dr. Pappas, with his calm spirit and comforting demeanor, explained my circumstances to me. I was transferred to the adult surgical heart unit, where I was surrounded with the care of the most professional, heartwarming staff and nurses I've ever had. It was in the adult surgical heart unit that I met the owner of the second set of gifted hands, Dr. Anton Tatulis. Dr. Tatulis explained to me that my surgical procedure bared a great sacrifice. That sacrifice was the natural sound of my voice. The main vocal cord had to be compromised in order for these 2 pair of gifted hands to perform the surgical procedure thoroughly and effectively. It has taken me several years to get used to the sound of my voice. Even today it has its disadvantages. But overall, everything is okay. And life is all right. Because we are all in gifted hands. In December of 2006, Marfan Syndrome came its closest to killing me. This surgical procedure involved the portion of the aorta called the thoracic. Once again, the phenomenal team of Dr. Pappas and Dr. Tutulis used their gifted hands to save my life. In 2010, I was introduced to my future, now present godsend, the phenomenal vascular surgeon, Dr. Martin Ellenby. In February of 2012, after 2 years of monitoring, Dr. Ellenby performed the extremely difficult surgical procedure of replacing my entire abdominal aorta. In February of 2015, with the assistance of the gifted hands of the incomparable Dr. Dean Gaspastis, Dr. Martin Ellenby performed a successful aneurysm repair and blood flow reconstruction on the right side of my vertebral artery, the artery responsible for blood flow to my brain. Now that I have proven to you through my personal surgical experiences that I am well qualified to speak on behalf of these phenomenal doctors, I want to speak to you, my fellow survivors. I know you're lying there with all types of thoughts racing through your head. You're scared, nervous, even worried about how you will be after the surgery. Let me assure you, these thoughts are normal, and in no way are they out of place. If you feel the need to cry, by all means, do so. No one can tell you how to feel, nor should you allow them to. But allow me to share this with you. Tears are not a form of weakness. They are the body's way of cleansing the soul of everything negative. Emotions like doubt, fear, and worry are all carried out of the system and replaced with strength. The strength that we need to close our eyes before each procedure, and the strength that we need to open our eyes once the procedure's over. Keep a positive mindset over doubt in every situation. Positivity, Positivity, stands for placing one situation inside the inner vision, illuminating through you. What this means is no matter what your circumstances may be, have faith that the outcome will be in your favor. Remember, all of God's lessons come with blessings. You are in the right place, surrounded by the best care, and everything is going to be all right. And do you know why, fellow survivors? That's right, because you are all in gifted hands. Now, your road to recovery will be a patient one. Make sure to follow all of your doctor's instructions thoroughly. Take the time to learn your body. Make adjustments where they are needed. One thing is certain. We didn't ask for this situation. But everyone has their specific challenges, their own crosses to bear. And for this situation right here, and now, you are the strongest person for these circumstances. This is another chance at life. Another chance to get it right. To them that much is given, much is greatly required. Use your experience, your influence to inspire others going through difficult times. If you're young, use this second opportunity to chase your dreams and achieve them. The world needs your contribution. Hopefully, with my gift as a writer, I have become an inspiration to you. And as you become an inspiration to others, remember, together we will make the difference and show the world that we are all in gifted hands. I am Michael the Feminist Martin, fellow Marfan Syndrome survivor, saying good luck and God bless you, fellow survivors.